Everybody, good morning, afternoon, or evening, depending on where you are joining us from. I'm pleased to welcome you on behalf of the UICC offices in Geneva, Switzerland, to today's virtual dialogue on breast cancer advocacy. My name is Sabrina Zucchello, and I'm a senior manager for women's health at UICC, and I'll be moderating today's session. And this meeting is part of UICC's virtual series on breast cancer, which aims to foster focused discussions within the global breast cancer community, and it's supported by the breast cancer program of UICC. So today we're together with renewed breast cancer advocates, and we will explore how civil society across countries and across continents is driving change and advancing the right to health for women. In particular, we will highlight progress in early detection, timely diagnosis, access to multimodal treatment, and the development of national breast cancer policies, all in alignment with the WHO Global Breast Cancers Initiative goal of saving 2.5 million lives from breast cancer mortality by 2040. So this session will be structured in 3 different parts. First, Dr. Mary Nyangasi, the technical lead for the WHO GBCI, will introduce us to the initiative and its objectives and share how advocates can support breast cancer care in their local context. Then we will have a panel of civil society representatives from Brazil, Canada, and Indonesia, and they will be sharing practical examples of national-led advocacy initiatives for breast cancer, including the successful political milestones that were driven by their efforts. And finally, my UICC colleague, Rosanne Lamplou, will present a newly launched handbook designed to support advocates in developing national breast cancer advocacy strategies. So let's dive in, and please join me in welcoming our first speaker, Dr. Mary Nyangasi, the lead for the WHO Global Breast Cancer Initiative. Thank you for joining us today. Dr. Nyangasi joined WHO in this role about 1.5 years ago, bringing with her a wealth of experience from her previous position as the head of Kenya's National Cancer Control Program, where she spearheaded key initiatives and helped establish cancer treatment centers in the country. She is now leading global efforts to scale up the WHO GBCI in countries around the world. And Dr. Nyangasi, we're privileged to have you here with us today, and we're looking forward to hearing about what is the GBCI and what is the active roles that advocates can play to advance the initiative. So I will upload your slides. Can you see that?
Yes, thank you, Sabrina. And really, it's my pleasure. I'm really honored to have this opportunity to speak to advocates about the Global Breast Cancer Initiative. And I want to thank UICC for providing the platform to reach the advocates and discuss what the Global Breast Cancer Initiative is all about, noting that advocates have been instrumental in shaping agenda for many diseases, including HIV, malaria, among others. So the same can happen for breast cancer, and that's why I'm really honored for this opportunity. So next slide, please. So I'll just give you a brief overview of what the Breast Cancer Initiative is all about. It was established by the WHO in 2021 with the sole objective of reducing global breast cancer mortality. So what we see right now is a rising mortality rate of breast cancer, especially in low and middle income countries. So we see generally, when you look at the global picture, there's a decline in mortality, mostly in the high-income country, but we see a different trend in the low-income settings where there's a rising mortality. And so this is actually an issue of health disparity and an area that we really need to address. Otherwise, we will have many women suffering from preventable deaths. So our goal in this initiative is actually to reduce by every year 2.5% for the next 15 years. So we need that by 2040, all countries must achieve a 2.5% per year reduction in breast cancer mortality. And how do we do this? We have three key operational strategies, and these are evidence-based strategies that through health promotion and early detection, where we have 60% of breast cancers diagnosed in stage 1 and 2, and having timely diagnosis within 60 days of presentation at a health facility, and 80% treatment completion for breast cancer. Breast cancer patients, we can actually achieve a reduction of 2.5% per year in mortality rates in our countries, and achieve the goal of saving women. Approximately 2.5 million of them will be saved if we achieve this goal by 2040. Next slide. So advocates are very crucial in bridging the gaps. Actually, advocates are the soft voices that penetrate between the healthcare providers, patients, and the policymakers. And the impact that we anticipate is that they will be able to enhance awareness around what is the Global Breast Cancer Initiative. Many of our healthcare providers may not know what the GBCI is all about, and not to mention patients and policymakers. And so advocates can be instrumental in creating this awareness, in promoting early detection, and even supporting patients through their journey. And this is really impactful, especially when we are dealing, when the advocates maybe are persons with lived experiences who are able to narrate, what they actually went through. Next slide, please. So this is a slide that I've also just put to share with you what advocates can do in terms of dispelling myths and misinformation. As you know, there's a lot of myths and misinformation that go out there around cancer, and breast cancer is also not excluded. And this is an expert I got from the WHO report on cancer in 2020. There are some myths that I've highlighted there. For example, in some communities, it is believed that cancer cannot be prevented. In other communities, cancer is perceived as a death sentence. There are places where people think that cancer is contagious. And in some settings, there could be beliefs that everything causes cancers, and there's so much misinformation around what will cause cancer. And then there are people who also believe that children don't develop cancer, and some areas where you are actually forbidden not to attend certain care because it will make your cancer worse. So I've seen communities, for example, where women are discouraged from attending surgery when they have a lump, because it is believed that that surgery will make the cancer grow. So these are some of the opportunities that advocates have to dispel and, demystify communities. So when we start thinking about how to dispel myths and misinformation, some of the questions we can ask ourselves in our communities are, is someone doing something already about it? Are there any local practices that are solving problems? And what decisions are people making based on their lived experiences and survival logic? In the community I come from, which is somewhere in Western Kenya, it is believed that cancer is a death sentence, and so there's a lot of stigma. And people might have made a logical survival logic around not getting themselves diagnosed because they are afraid they will die. So these are some of the decisions people will make because of a misconception. So it's good to understand what are the decisions in your community, what are the kind of beliefs, and what decisions are people making because of such beliefs and survival logic. And I can say that there is no one to blame for this. It's because whenever they see anybody in that setting, I have mentioned getting cancer, most of them die. Statistics actually show in that community 70% of persons with cancer will not survive. So when they see persons with diagnosis of cancer dying, the logic is they want to go and get diagnosed because you will die. So we need to dispel this and see how we can transform care. As we are dispelling the myths, we are also advocating for changes, knowing that we can actually change the scenario. So that takes me to the last point of what tools, what knowledge, and what resources are available. Next slide, please. So in terms of health promotion and early detection, and I think this is a place where we see a lot of work that advocates can do in educating communities about what is breast cancer, what are the symptoms of breast cancer, how can you do a self-breast assessment, how can you participate in screening if it's available, or early detection for your breast cancer, early diagnosis. I think advocates have a role to even sit down with women and show them how to do a monthly self-breast exam, for example, and perhaps organize awareness campaigns within their communities, collaborating with other health organizations and providing breast cancer, support and screening as part of the other health interventions that are provided in the community. So what we need to know when we are communicating, with thanks to my colleague from Risk Factors Division who provided me with this slide, communicating with common sense, relating what you're communicating to the community. So use of metaphors, sharing stories. You notice in my presentation, I didn't want to put the 90% statistics, 80%. I wanted to talk. So sharing stories, experience is more persuasive than putting numbers. And also just tailoring your language to the local culture, local context. And if the message is confusing, of course, it won't land. So try and speak the community's language literally, sometimes being figurative, so that you are actually in the context of their understanding. And another aspect is, how do you challenge local logic? This is also a challenging area that advocates might face. So the first thing you need to ask yourself, is this practice causing harm despite good intentions? Is the community open to adapting if engaged respectfully? There's also a way you need to engage in a respectful way without making anybody feel inferior. And then sort of co-creation for a safer alternative, so that whatever you tailor as a solution is not imposed, rather it's co-created. And it's not more of contradictory, rather than replacing risk, it's correction, don't really contradict, replacing risk with reason. Identifying trusted messengers is also very useful in your communities. For example, teachers, elders. In some communities, religious leaders have really are hard. So it might be useful to just see who is a trusted messenger and use them in the delivery of these health promotion messages, including community input when you're planning. When you're planning how you'll do your program for health promotion, make sure you get the community in the planning stage so you don't surprise them at implementation. And then framing scientific advice that align with their everyday logic so that it's not, like parallel, it's like simultaneous with logical thinking. And just making sure that in this way, we are able to get what we call shared ownership. Once we achieve shared ownership, the program is more likely to be sustainable. And even when you leave the community, you will be sure that the work will continue, Next slide. So also in the area of timely diagnosis, advocates can facilitate access to diagnostic services. They can help to improve the infrastructure by talking to the policymakers about what is required. They can help in terms of access. You know, when you look at access, you must think about it in 3 dimensions: affordability, accessibility, and the other part is there's a third A, but it's basically how the people reach the facility, how affordable is it to them, and then supporting initiatives for affordable and accessible diagnostic tools. There could be innovative methods of doing things. This can be supported by advocates so that the community can adopt, and even the national stakeholders and policymakers can look into them. Working with the healthcare providers is very important because changing the mindset sometimes might help to improve and reduce waiting times. Next slide. There's also a role of advocates in comprehensive breast cancer management. Actually, advocates are very instrumental in patient navigation. So I've just shared the patient navigation technical brief that the WHO launched in October last year. So patient navigation encompasses early detection, diagnosis, and treatments actually across the entire care continuum. And it ensures patients receive holistic care, right? From the point of early detection to diagnosis and to treatment. We also advocate that advocates help to have policies in place that can provide assistance like financial assistance, even transportation assistance for patients to be able to access their treatment, especially in the time, for example, for transportation and accommodation. It may be relevant during radiotherapy, where patients might need to be going and coming back for their sessions. So this is the kind of support that advocates can help to establish accommodation, transportation for patients to and from the facility. Promoting patient navigations can also help patients navigate the complex healthcare systems, especially because in breast cancer treatment, you have to go through surgery. Sometimes it might need radiotherapy, chemotherapy. So navigating all these multidisciplinary team might be complex for some patients. Yeah, so patient navigation is useful. Next. So I'll just share that one of the ways that we can be able to amplify breast cancer is highlighting successful advocacy campaigns, as you'll hear from this meeting. Next slide. How do you get involved? I've already spoken to this, but maybe I can just emphasize. We can be involved in steps for breast cancer advocacy, joining or forming local breast cancer advocacy groups, partnering with healthcare providers, patient support groups, and other organizations, participating in trained programs. We are also really advocating that our advocates become empowered, by participating in training and become certified as advocates, empowered to advocate and communicate the right message. Next. So in conclusion, community leaders and advocates play a key role in advancing the breast cancer agenda. They raise awareness and educate the communities. They build support networks within the communities, and they champion patient navigation. And this is just some of the things that they do, and really a call to action to encourage you all to take active roles within your communities and advance breast cancer advocacy efforts towards reducing the burden of breast cancer globally. Next. So I think that's my last slide. If there are any questions, maybe Sabrina with your guidance. And many thanks for listening to me. Thank you.
Thank you very much, Dr. Nyangasi, for this excellent presentation and complete overview of the role of civil society organizations. I really liked what you say at the beginning about advocates being this soft voice influencing policymakers, and also the fact that it's so important to share success stories and encourage others in their work they're doing in advocacy. So we're moving to the second part of the webinar, going to do just that. getting encouraged by listening to three amazing panelists that have joined the meeting today. And we are going to hear about what are the key principles or strategies that civil society can adopt for effective advocacy of breast cancer, and how this strategy led to concrete political wins supporting early detection, timely diagnosis, and improve access to treatment and care for breast cancer. So we're pleased to invite our first panelist, Dr. Mayra Khalifi, who's volunteer president of FEMAMA in Brazil. Warm welcome to you. Dr. Khalifi is a breast surgeon and UICC board member committed to advancing breast cancer care and early detection in Brazil. Alongside the network of organizations under the FEMAMA umbrella, she has played a pivotal role in advocating for better access to cancer treatment and services. And Dr. Khalifi, can you share how FEMAMA successfully unified voices across the country to raise awareness for breast cancer issues you're fighting for, and how your advocacy led to structural changes, in particular, improving the timely diagnosis? Thank you. The floor is yours.
Thank you very, very much for the invitation. I am thrilled to see so many people in this call. I really feel that Mary has been a leader, a true leader, and now I'm trying to convince you that we have to launch a GBCI community within the cancer community, because I think that we know how much the Global Breast Cancer Initiative can be structurally the main driver for change in cancer care. And I believe that, really. What I would like to share with you is that just to pinpoint exactly what was said by Mary and Sabrina, that the importance of civil society organizations represented mainly by patients' organizations are increasingly important to influence public health policies, especially in developing countries. We should assume and to be in this position of civil society as before we need to get people aware of the problem as not only a local problem, but to convey as a global problem, increasing global problem, breast cancer problems, breast cancer care. And the other is to convey in second that is curable. That this is the main thing to promote change. People, the community, the lay people, patients and relatives and anybody should understand and believe that is a curable problem. Okay, this is, for me, I think that this is what really made a difference in Brazil when we brought forward, and I'm not even talking about FEMAMA's advocacy yet, when we brought forward survivors, when we show people that this could be cured and is not a death sentence, then you have to play with people that they should be active in politics, because people love to say that they are not getting involved in politics. Well, if the citizens are not involved in politics, governments do whatever they feel like, whatever they want. And that is when you start to empower organized civil society. So I'm very lucky to share with you this experience of being, now I'm not only the president, but I feel more like a founder of FEMAMA, because FEMAMA now grown over people it is so big, so powerful in Brazil. It's more than 70 patients associations working together. And Mary, if you ask me what is the recipe for making this group connected, is that we are an united patient advocacy group. We make meetings online and even presential that we decide things together. And Brazil is huge. So, and we respect each identity of our associations, but we have evidence-based policy engagement that drive us together to a purpose. And for us, for FEMAMA, the Global Breast Cancer Initiative, is our mission, is more than a purpose, because we believe that the way how was established, and I've been working in many groups as a doctor, as an advocacy expert, because I think that nowadays we know how to influence the public health policies, especially the ones dealing with cancer. First of all, I think that we have to establish strategic partnerships with medical societies. If we stay apart, we are not going to get anywhere. And I know how difficult it is, because, being a doctor, I know how much we suffer for years and years before we've been sitting on the same table and making proposals and going together to governments. And the other thing is, like, now we have like a Bible, the Global Breast Cancer Initiative. If you want to make a change, we have the 3 pillars. I think that is a little bit, is very clear to me that we need to improve early diagnosis, because is the way that maybe the developing countries can afford to deal with cancer, breast cancer, because it's stage 3 and 4 is very difficult to, it's not only that it's difficult to cure, but it's very expensive to treat, expensive to patients, how much they are submitted to treatment, but also for the public costing of the disease. Well, in fact, we talked about investment and not cost. We're trying to teach policymakers that they are not spending money, they are investing money. And I think that when we put together FEMAMA's people together to think about this meeting, we realize how much we still can do about the Global Breast Cancer Initiative. Because, you see, we know in Brazil, by now, for the last active almost 20 years, we made important strides, in fact, in approving important laws, as the 60 days law, that maximum time to get the first treatment, the 30 days law to get diagnosis done completely within 30 days. We have something like a mandatory notification of cancer cases. So things that really, it's not only more for breast cancer, for all cancers, but we have to be active in monitoring this. This is the other side of being an active advocate. We need to pass the laws, but every other 4 years, every other 2 years, governments change, and they sometimes they don't, they make some I don't know how to say, but amendments that law is changed, and that we should be aware all the time. And just to conclude this first participation, I think that is very, very important for to go back, and we should establish under the UICC umbrella, and I'm so proud to be a board member for so many years, and I'm going again next year. Wait for me. I'll be there because I believe that UICC can play an amazing role in putting together and making a kind of a monitor, Sabrina. We need to help Mary to have a monitor, kind of thermometer, can I say this, about the UI GBCI pillars. So when we went back now, Gabrielle is here and other people from, I can see also America's Amigas are here. When we went back to see what we're doing about the pillars, we realized that we're not doing enough. Mm-hmm. And our main problem, and for example, share the positive already. Before we have like 60% already in Brazil, stage 1 and 2. Mm-hmm. So we should think, wow, but the survival, so you're improving mortality. No, not yet. Because if we don't have the two other pillars, that's mm-hmm. not enough. Mm-hmm. Second pillar, we monitor the days. Oh, now after the law, the 60 days law, it's not only, it's like an indicator of performance of the cancer center, the public cancer centers in Brazil. So laws don't help, they do. So I really emphasize that is a way to go for us. Mm-hmm. But the third pillar, after all that investment, Mary, this is like my confession, my fault. After all what we've been doing, we cannot really monitor if they are completing treatment. Mm-hmm. And this is, so think about, we invest for awareness, early detection, 60 days, good adequate treatment. And then if we don't perform the 80%, monitoring the end of the treatment, mm-hmm. it's not good enough. Yet. Maybe I'm just raising in public here is mm-hmm. the way why we are not achieving mortality rates decrease up to now. Yeah. So my last message is believe that each one of you and in your groups make a difference. Yes. Persist. It's an everyday commitment. Mm-hmm. Second, we need to be under one umbrella mission, and the Global mm-hmm. Breast Cancer Initiative is there. Third, let's try to have a type of monitoring within the UICC community. And mm-hmm. that's like looking back in 10 years' time, in 5 years' time, we see how much perhaps we save, how many women we save. Yes. Thank you so much.
Excellent. Thank you so much, Dr. Kalerpi, for sharing this inspired work that you've done, but also giving this overall perspective on how we all need to work together, continue to advocate, and when we have successes, the importance of monitoring across the three pillars. So we'll now are going to move to our second panelist. We will continue to try to share briefly the interventions for trying to stick to the time. And for the second speaker, we're going to stay in the Americas, where we'll hear now about civil society organization as an example of high-income countries and how to work to address gaps in breast cancer. And for that, we would like to warmly welcome MJ Decoteau, founder and executive director of Rethink Breast Cancer in Canada. And MJ, one of your organization's strengths lies in engaging community, especially younger people, through creative and evidence-based, accessible messaging to support breast cancer advocacy. You describe yourself as a friendly disruptor in how you approach this work. So can you tell us about the strategies you found most effective in your advocacy and how these approaches have driven policy change?
Thank you, Sabrina. And I just wanted to say thank you so much for inviting me to share a little bit about our organization. I agree with everything the doctor said, so it's fun to sort of build off of that. Yes, we are friendly disruptors because we in Canada, our organization is here to represent the community and work with government, whoever that government is. We just had a federal election last night. I'm a bit tired because I was up late waiting for the results. But yeah, I really think I'll use my time really to focus on our model and what's worked because I think the actual campaigns are so different. We are a developed country, so we're often advocating for access to expensive medicines for our metastatic community, which is a bit different. But I think still one of the challenges that everyone will relate to is when it comes to advocacy and making change, you want to create urgency at the same time as not fear-mongering. And I think this is important in developing countries when you're trying to shift the message away from breast cancer being a death sentence, yet you're trying to make your point and advocate. You have to really think through what is the exact right message. But before you can even get to message development, a lot goes into advocacy, and I love the recommendation that Mary made to team up with a patient organization because we do have the resources, the history, the connections, the understanding in the space to sort of take the urgency that our patients are coming to us with their own situation and then figure out, okay, how do we help? Because some people think advocacy is just going to government and yelling and making noise, attack and make noise, or maybe a report gets published and it's just something that's sitting on a shelf and not being activated. So you need to figure out, okay, how are we taking that report and activating it? So for us, it really starts with addressing isolation and building community. It is very hard to just advocate and make change. You need a lot of voices calling for the same thing, and you need a community that's all pushing the same ask. So it really, for us, advocacy starts with building community. It starts with bringing patients together and listening, and that's how we identify the stories we're hearing over and over. The same issue keeps coming up. Then you have to gather the evidence, and that involves, we're a small organization with a big kind of engaged community, but in terms of resources, very small. So sometimes we will team up with a larger organization that has the resources and the bandwidth to do that type of evidence-based needs assessment. Sometimes we do it ourselves if we can get the right funding. And that's really part of identifying what our ask is going to be to government, or what exactly is the issue. And it does involve a lot of consultation. It's talking to we represent the patients, but we're talking to our physicians who are on the front lines of treatments. We are talking to the drug manufacturers to hear their pain points. And, the manufacturers are often more willing to come forward to the patient groups with, this is a problem, this is a problem, this is a problem. But we also want to talk to governments. We want to talk to the bureaucrats. It's so important to understand everyone's pain points. And from there, that's how you can identify what is the actual recommendation that is going to move things forward and make real change. From there, it's, some people from the outside might think, oh, they launched a petition and they did an advocacy day and had all these people on the stairs in front of government and they made a change. That's what it looks like on the outside. On the inside, it can be, a slow process because you want to do all that consultation to identify what your campaign is going to be. Then you want to advocate behind the scenes. You really want to have meetings with government, try to condition them to your ask, start to get people really familiar with, what your message is. Then it's about training advocates to participate in the ask in that more public way, humanizing the issue. For us, our advocacy starts with those personal stories. Then we do the evidence gathering and identify the ask that we're going to make to government. Then it's bringing the patients into meetings, helping them be in the having them highlighted in the campaign to humanize the issue. Again, it's always a balance between the emotional appeal, the creating urgency, and then the evidence-based side is needed as well to have that trust in what we're asking for. And then for us, it is about just really amplifying the voices of the community and engaging the public in some kind of, for us, it's been a digital marketing approach. Social media has really helped us over the years to make change, and email campaigns. And I will say it takes many, many voices calling for the same thing to make real change. So often we team up with other organizations. We're part of coalitions on certain campaigns. I like to say I like a partnership where we're aligned on goals and we're aligned on strategy, because some people have very different values when it comes to how they want to campaign for change. So we really align with organizations that share our values. And but we have very different strengths. An example would be, we have a campaign called Bitterest Pill, and it's in one of our provinces. And we've been advocating for equal access to oral cancer therapies. So Bitterest Pill, because we're advocating about take-home cancer treatments. In our province, if you are over age 25 and under 65, and your therapy that you need for your type of cancer is not an IV, you face enormous hurdles, delays, a lot of paperwork. And this has been an issue that's affecting our community. So we've been advocating. We're part of a coalition of groups that are working on this. Rethink has really kind of been a leader in the coalition. We're good at advocating and engaging the public. We're good at engaging the community. The person who I really lean into at another organization, he is the policy person. He loves digging in deep on the policy, getting in the weeds of that part of it. And then together, he's really good at that. We're good at engaging the community, but together we've been able to make change, and not without our frustrations, because it took years and years and years of meetings. At one point, the opposition government was asking questions on our behalf in question period and making a lot of noise. Then we had a change in government, and that very same government that was, calling out the previous government changed their story and suddenly weren't helpful on this issue. And that can be frustrating in this climate where governments are looking at 2-year election cycles. However, over time, we were able to leverage going into an election again, and we were able to get all parties in the campaign, like running for re-election, to commit to solving this issue. So that was a huge win in 2022. It did take 8 years to get to that point. It's not always that slow, but I wanted to sort of be transparent about what can go into it. And we've had certain wins along the years that change was made, problem solved. This is an example where we had a win, and implementing it on the other, the change hasn't actually happened. There was a commitment with no follow through. So the advocacy continues, unfortunately. So I don't know, I think that's probably, I'm at time, but I just encourage you to keep going. Sometimes change is quick and sometimes it's slow, but along the way, building community, getting people engaged is what keeps me moving things forward. Small wins.
Thank you so much, MJ, for sharing these stories and the reality of what this is. The advocates need to continue to amplify and unify, ask, talk to all stakeholders to hear everyone's pain points. And sometimes it's successful and it's not that painful, and other times not. That's the reality, but we all need to keep pushing. So thanks you so much. We'll now move to our final speaker and now go to hear about Indonesia. So please join me in welcoming Marco Wijaya, Patient Navigation Project Manager at the Indonesian Cancer Information and Support Center, CISC. Mr. Wijaya is a biotechnologist by training and is deeply passionate about improving healthcare outcomes and enhancing patient well-being. At CISC, he supports patients in navigating their treatment journey and accessing timely breast cancer care. So today, Marco, you'll be sharing some of CISC's work with us, including how your organization, in collaboration with a coalition of civil society organizations, is supporting the Ministry of Health in developing a national action plan for breast cancer. So can you take a little bit about the CISC advocacy journey and how you managed to build coalitions, and also an important work of your organization is about engaging the people with lived experience in advocacy. So the floor is yours. Thank you.
Okay. So thank you so much. Good evening from Jakarta, everyone. Thank you for being here. My name is Marco Wijaya. I'm a volunteer. I am helping CSC as a project manager, mentioned before. So I would like to share a bit of our advocacy journey with all of you guys. The Indonesia Cancer Information and Support Center, CISC, founded in 2003 in Jakarta. It's grown from a small local group to a national network in 12 cities with over 3,000 members. Driven by a grassroots movement, the ISC bridges the gap in cancer information and psychosocial support. We work with healthcare professionals to promote public education, empower patients through training programs like training of trainers and training of supervisors, alongside art and wellness activities such as yoga, dance, and knitting. These efforts help patients feel supported, make informed decisions, and ensure the best personalized cancer care and survivorship possible. You can find us on Cancer Club CIFC to know more about the core information. Responding to questions about the practical ways in performing a strategy for breast cancer control. What we do is performing parallel action, a combination of community engagement, policy influence, public education, and partnership with stakeholders. I would say those key elements have always been the core of CIFC. By implementing those, we have started meaningful changes in Indonesia, such as through coalition, joining voices in National Cancer Forum. We got the opportunity to participate in shaping Indonesia National Cancer Control Plan and pioneering patient navigation in Indonesia. Talking about the patient navigation, it's a huge honor to be able to learn and implement the movement. We introduced lay navigation to help guide patients through their cancer journey. Starting in 2022, helping a hospital, and now in 2025, we have provided the service in 4 different hospitals with a better performance each year. It won't be happening without the devoted work of the navigators, the support provided by the UICC that introduced us to the Beacon Initiative, uh, American Cancer Society, and also the technical brief on breast cancer patients on breast cancer patient investigations by the WHO. We believe patient navigation is a highly effective approach to implementing GBCI points. We have had multiple discussions with the Ministry of Health and are confident that this practical and impactful program should be implemented nationally. We are still fighting and advocating for this, but we are extremely proud of the patient navigation program we have launched, as it aligns with the key GBCI pillars, such as Pillar 1, raising the awareness, building the community trust, and addressing the stigma surrounding cancer. Pillar 2, initiating navigator roles to eliminate barriers to care. And pillar three, using patient stories and data to drive public and political attention to treatment gaps. One of the advocacy cases we have is from 2018, when we just start advocating for access to breast cancer medication. It happened shortly after joining patient group mentoring program by the ICC. We successfully campaigned for trastuzumab, a critical breast cancer medication. The challenge emerged when the Ministry of Health proposed that trastuzumab would not be covered under the National Health Insurance, despite its inclusions in the National Health Formulary. This decision posed a serious barrier for patients in need of life-saving treatment. In response, the IFP launched a comprehensive advocacy campaign to reverse the proposal. Our efforts included submitting formal letters to the Ministry of Health and members of Parliament, running collaborative campaigns with key stakeholders, including the policymakers, hosting educational webinars with oncologists and survivors to emphasize the importance of trastuzumab for treating HER2-positive breast cancer, and also launching a social media campaign, Indonesia for HER2, leveraging the popularity of Facebook pages that is trending those days. Also, the collective effort with other cancer organizations. We held a seminar, Health Law and Advocacy, inviting the Ministry of Health and also the Directorate General of Non-Communicable Disease Control. We also held several press conferences with the media to raise the issue. Not long from that, we got positive response. February 2018 is the first action of the movement. Within then less than 4 months, on June 2018, the issuance of the Ministry of Health number 22 was published. Trastuzumab is covered by governmental insurance 8th cycle for metastatic breast cancer patients. And this campaign not only helped secure access to trastuzumab for countless women out there, but also demonstrated the power of unified patient-centered advocacy. We also, another powerful example is how cancer organization advocacy drive meaningful changes is the formation of the National Cancer Coalition. CIFC, together with 12 other cancer organizations, comes together under Forum Advocacy to create a national front. The coalition was formed to strengthen our collective voices, shape national policy, and promote evidence-based solutions to real challenges in cancer care. By uniting efforts, we ensured the National Cancer Control Plan reflects the actual needs of patients, survivors, and caregivers. Our joint campaigns led to several key outcomes officially supported by the government. The first one is to accelerate the National Cancer Plan 2024 to 2034 with clear policies, guidelines, and resources that is being allocated to execute the plan. And also, we are going to focus on breast cancer action plan, prioritizing breast cancer with a strategic action plan aligned with WHO, GBCI. Also, we secured long-term funding for prevention, early detection, and treatment in line with WHO mortality reduction target. We also strengthened the partnership. Public, private, and public collaborations are fostering resource mobilizations and accelerating initiatives. Our approach in the advocacy journey is actually quite similar with what UICC taught us. It was the problem identification, and then finding the champion. We trying to find a relevant cancer survivor that led the charge. And then we are trying to identify the supporting key stakeholders and then develop a policy brief. And then we are implement the movement, making the advocacy event such as FGD with policymakers. Usually, we are trying to invite the public characters that have the same interest and understand the importance of the raising point. And then we do the evaluation until we got the positive response. To conclude, the IFC's advocacy for breast cancer control is built on multidimensional approach combining community engagement, policy influence, public education, and strong partnerships. While building coalitions isn't always easy, it enables us to sustain practical advocacy that overcomes systemic barriers and deliver lasting solutions. Together, we respond more effectively to real-world evidence-based challenges faced by patients and communities. Let me close my part with a beautiful quote. Collaboration is the foundation of success. Competition divides, but coalition multiplies impact. Okay, that's all from me. Thank you so much.
Excellent. Thank you so much to you for highlighting the very rich role that civil society organization like yours can play, not only coalition building, influencing policies, raising lived experience voices, patient navigation to support achievement of the three pillars. And you're still a small organization, so we're really, really impressed by you and want to warmly thank you as well as the other panelists and speakers. So we are approaching the end of the meeting, and we have one more presentation to go about the Breast Cancer Advocacy Handbook that UICC has recently published. So for those who need to go at the hour, just feel free to disconnect. And for those who can stay over a few more minutes, you're welcome to stay in as we will wrap up this webinar. The webinar is recorded, and we will be sharing it on the virtual dialogue page in a few days. So if you miss just this last part, you will be able to see the recording. So let's move on to the presentation of the Breast Cancer Advocacy Handbook. Roseanne Lamplou, Senior Manager for Capacity Building and the lead of the UICC Cancer Advocates Program, has been leading the development of this new resource, which is a handbook designed to guide and inspire cancer organizations to mobilize governments and prioritize breast cancer within national funding and policy agendas. So, Roseanne, can you tell us a little more about the handbook and about how the advocates can use these resources in their work?
Of course, thank you. You may see Sabrina in green and I am on mute, but it is because we're in the same meeting room together. So in case you're confused. So I think it's already been very well evidenced by the previous speakers with their incredible stories and the role of CSOs and patient groups in being so critical to advancing breast cancer care. We've had some really useful tips on this idea of collaboration and working as a coalition to advance advocacy efforts, and particularly in influencing decisions around national policies and planning as well. So I'm going to very swiftly take us through a little bit of the Breast Cancer Advocacy Handbook with some information on kind of how it was developed, the process that we went through, an overview of the content, and then signpost some other resources that complement the handbook that you might also find useful. So let me go forward. So just as a bit of a background, as Sabrina said, the handbook was really developed to support civil society organizations, coalitions, patient groups in their advocacy efforts linked to the GBCI framework. So it follows very closely the GBCI framework. The handbook was co-developed with experts and representatives of the breast cancer community. So many of those are on this call today, and as well some of the UICC members who are involved in a consultation process. So we did a little bit of a kind of test feel out to see how it responded to the needs of the UICC members around the world, and if it was accurate in terms of messaging and the right kind of advocacy support that they're looking for in their work. And then, as Sabrina mentioned as well, I work on the UICC's Cancer Advocates Program. So a lot of the handbook draws on some of the insights and tools that we have through the program, including these successful case studies from UICC members. So some of the speakers today are featured in the handbook as well. And it's really hopefully an inspiring and useful tool for our members and beyond. And the handbook is available in English, French, and Spanish. It was launched at the end of last year in late 2024. So this is just a kind of overview of what the handbook kind of looks like in terms of the main areas. So we look at coalition building, so the kind of partners that CSOs or patient groups might want to include in their coalition, specific to advocacy more broadly, but also specific to breast cancer control. And then a large part of the handbook is really focused on this advocacy strategy piece. So this is where I would say we really kind of dig into the GBCI framework, and we look at each of the pillars and how different organizations might advocate for each of the pillars, depending on the socio-political context in their country. So kind of identifying which advocacy angle might be used. And in this part, we have some real life advocacy wins from our members, and including, of course, the importance of including people with lived experience, which has been talked about today as well. And then at the end of the book, we actually have the bitter pill that MJ spoke about as the campaign to kind of show how to develop robust messaging and clear, concise, evidence-based, and then looking at how key dates as well can be leveraged for advocacy efforts. Beyond that, we have some information as well on monitoring, evaluation, and learning, and also fundraising efforts. These are covered quite extensively in some of UICC's online learning materials. So we don't go into too much detail in the handbook, but we kind of signpost towards more comprehensive materials that might be useful for people to follow. So this is just an example of this kind of chunky part of the handbook that I mentioned around the advocacy strategy. So this is taken from that part of the handbook. As I said, the majority of it is really looking at this level of political will when developing an advocacy strategy, and how advocacy messages and key partners can be leveraged to kind of increase existing political will or start to engage political will as well. So this is an example for Pillar 2 in a country with high political will but slow progress, which we've called the implementation stage. You can see here on the right, we kind of have this quadrant of, if you're in a country with low political will and slow progress, you might be looking for the national drive, high political will, slow progress implementation, and so on and so forth. So there's these kind of 4 contexts that we framed the handbook around. So for example, in this context, in the implementation stage for Pillar 2, there might be, for example, national guidelines in place. So advocacy efforts could focus on pushing for the implementation of referral pathways and organized patient navigation programs to support the goal of diagnosis within 60 days of initial presentation with a breast abnormality. So this is, again, a bit of an illustrative example of the kind of guidance that you would find in the handbook. And we do encourage users of the handbook to really kind of adapt it to their national context. It's not a one-size-fits-all, but rather some ideas of how they might be able to approach the advocacy efforts in line with the GBCI framework. So in summary, this is kind of the goal of the handbook. It's to equip advocates with the knowledge and resources necessary. And you'll find at the end of the handbook, there's a long list of other resources that you might find useful as well in your work. Then the idea here is, as we've mentioned, to really raise awareness of political actors and position breast cancer as a national and global health priority. It offers ideas for whom to engage in advocacy efforts, including the policymakers, healthcare professionals, communities, and individuals affected by breast cancer. I think we've had some really nice examples today of how some organizations are engaging successfully with all these different actors. It provides guidance on how to focus advocacy efforts to support the breast cancer prevention, early detection, treatment, and supportive care based on the national context. And of course, as I said, it highlights these successful advocacy campaigns and initiatives from around the world. So we really hope this is an inspiring handbook and also very supportive for the work that everyone is doing. And then just to wrap up, to kind of signpost you to some other materials that might be useful. The handbook is designed to be a complementary resource to an existing advocacy toolkit that's developed by UICC. This toolkit was developed as part of the Cancer Advocates Program, and we've been using it with our member organizations for a number of years. It really kind of takes you through step-by-step guidance on designing and implementing an effective advocacy strategy more broadly. And then the handbook is kind of an add-on where you want to go into a bit more detail on the breast cancer care piece. And then we have an online course. It's a self-paced course on UICC Connect. And that's really introducing breast cancer groups to the 3 pillars of the GBCI. So this is a very useful resource if you're maybe not so familiar with the GBCI framework, to understand a little bit more about it. And then through UICC's breast cancer program, we have a number of resources also available on the resources for breast cancer control page. And we also have a nice kind of case studies, advocacy and action, cancer control stories from UICC members. So not necessarily specific to breast cancer, but some examples in there as well. And with that, I will wrap up because I know we are over time, but just to say, if you are using the handbook, perhaps Sabrina could put a link to the handbook in the chat. Perfect, she's already done it. If you are using the handbook or any of these other materials, then we would love to hear about it. So please do get in touch with Sabrina or myself. It's really great to hear if it is valuable for you, if you have any suggestions as well on how we can develop it in the future or add more information that could be useful to you. But yes, would love to hear about how you might be using it. Thank you.
Thank you so much, Razan, for this presentation on the Breast Cancer Advocacy Handbook. And we will now close this meeting. Thank you, all of you, the speakers, and everyone who made the time to come and are doing an amazing job day to day on breast cancer. So we've heard about powerful examples on how civil society is at the forefront of pushing for breast cancer control, be it by coalition building, evidence-based campaigns, community engagement, support to patients, amplifying patient voices, and all of this work is crucial to achieving the GBCI target. So we really want you to keep that message. As some of the speakers said, the work you do is important, and we are so proud of you. So thanks again, everyone, for connecting, and please feel free to stay in touch. Let us know if you have any questions, stories to share. We like to be in touch. All the best. Bye-bye.